In this video, you'll learn reasons as to why we have the tendency to overflex our low back and why it can be harmful. Any lack in the ability to flex our hip will result in a compensation of lumbar flexion. This is most commonly seen with forward bending. All right? So if I lack motion in my hip to bend forward, then what I'll do is I will compensate through lumbar flexion. If I have good hip flexion range of motion, as you can see here in the video, I'm not bad, I can flex forward nicely through my hip, keeping a nice straight back. If I have tight hamstrings, tight buttocks, or a tight joint capsule, those are the ligaments around the hip joint, that all those things will prevent me from flexing my hip. And as a result, if I can't flex that hip, I compensate with lumbar flexion. Many people actually have good hip flexion range of motion. They just have a poor habit of bending forward and overflexing their back. It's common people will bend their knees like they've been taught, but then they'll round their back forward, and then they'll actually extend their back on the way up. And over time, that'll lead to wear and tear. Perhaps they're doing some work like cutting some vegetables at a counter or washing dishes, and they'll just flex through their back rather than through their hips like they're supposed to. And those are just bad habits that need to be corrected. When we sit, it's very common that we have a tendency to overflex the spine. All right? We might slouch like I am right now. We might be here, overflexed. And those are just bad habits. Good sitting posture is really here, where my spine is nice and straight with a little bit of a lumbar curve and my core engaged. Also, too, when we bend forward, we'll find some motion through our hip, but it's very common that we'll actually get a lot of that motion through the spine. All right? So I'm flexing, but not only am I flexing here, I'm also side bending and rotating. All that combined will lead to wear and tear. So in sitting, it's real important that we try and keep that spine long and to maximize motion through the hip as able. There's a couple things that can go wrong with hyperflexion or too much flexion through the spine. And the first I would say is just an overstretching of tissues in the back here. So imagine there's a bunch of tissues that come up and down here. We have muscles, ligaments, and stuff that just holds everything together. If I overstretch that, that's going to lead to micro tears and eventually pain and injury. All right. Number two is, I can't demonstrate it super well in the spine here because it doesn't move a lot, but a lot of times if the spine is used to being extended, when we go to flex forward, rather than getting a motion through a lot of the joints, as I'm actually doing here in the spine, is what will happen is, rather than getting that nice motion through a bunch of joints, is there'll be a shearing forward. And imagine if you have a nerve that travels right through here. As we do in the spine, you can see how the nerves come right out between these vertebrae. If I get the shearing forward, okay, not only will that compromise the nerve right there in between, but it'll actually start to compromise this disc as well. So rather than getting a nice flex through multiple joints, it's common we'll get it through just excessively through one or two joints accompanied with some type of forward shear, and that could lead to a lot of problems. There's a group of muscles in the back that are very strong and powerful. They're called the erector spinae, and those are the muscles that extend the back, but they also help prevent flexion. Those muscles work best when the spine is slightly extended. All right, so if I'm in good posture, where I'm up tall and my core is engaged, my spine is still slightly extended. All right, and that's where it should be when I bend forward. Those muscles can only work well, they have a mechanical advantage when the low back is slightly extended. We don't want it to be too extended because that's its own problem, but just slightly extended where the natural curve of the spine should be. If we get into a flexed position like this, they lose the ability to prevent further flexion, all right? They lose their mechanical advantage. So one of the problems is, if I bend forward and I'm lifting up an object, all right, of some weight, those strong muscles that help really keep me in good alignment and prevent me from flexing forward, they can't do their job well. So by flexing forward like this and then lifting, it's a real recipe for disaster. So when I bend forward, I need to have that neutral spine and really bend forward through the hip. And you can see as I'm doing that, I'm keeping a nice lumbar curve. Again, I don't want you to think that this is good either, where I'm hyperextending, because that's creating its own problems. And if I'm hyperextended and then decide to flex from there, that's going to create that shearing phenomenon and too much motion at one or two joints. So really it's about getting into that middle with core engagement, into that neutral spine, and then flexing forward through the hips correctly. We have videos to show you how to do that. From the good posture video to the good bending video, there's a lot to learn that. So don't fret if that's kind of confusing. Lastly, if I'm bending forward and I have a flexed spine, inevitably to stand upright, I'm then going to extend my back. And that repeated motion of going from flexion through extension, back and forth, that'll ultimately lead to wear and tear. So those are many of the reasons why excessive lumbar flexion or repeated lumbar flexion can be harmful for you, harmful to you.